All right, now we're going to discuss dialectical behavioral therapy. This is a form of behavioral therapy, but with a lot more specific instructions and it's a very certain way of doing therapy. It's very intense. This is what we're going to go over briefly. One thing to know that dialectical behavioral therapy, it was developed by Marsha Lennon in the 60s and 70s and was based on two opposite ideas, but not really. Acceptance involves looking at things as they are without the emotional reactions or responses that was caused by past pain or trauma. Seeing yourself with no judgment, removing all the shame, all the guilt, and other emotion-based conclusions about ourselves. But the change is after we accept ourselves for who we are and what we have experienced, this happened, whether it was trauma or anything else that's happened, looking at our willingness to change. The change then is not motivated by the guilt, the shame, other negative emotions. The change is motivated by simply wanting to improve our lives and circumstances. We'll talk about a little bit of the Socratic questions that are used to help the patient or the client move forward in these changes. There's 4 essential elements. It's very intense. In this type of therapy, you have weekly individual therapy sessions, anywhere from 30 minutes to an hour. You also attend weekly group skills training, 2.5 hours a week, which that's pretty intense. There's also skills coaching via telephone or other electronic means as needed when the client is in a situation in the moment and they need help. So the therapist or somebody for the therapist is available for this client, for all these clients. The last part of this therapy is that there's team consultation to maintain fidelity and adherence, meaning the therapists themselves consult with other team members, and we'll talk a little bit more about that. Socratic questioning is one of the key points here that are used to help the patient really look at themselves. And here's a few types of them. I'll talk briefly about them. One is clarification. You may ask that person, why a person, okay, I heard you say this, why did you? Or tell me how it relates to what we're talking about. So just clarifying. A challenging assumptions is when someone may be asked what they've said, how do what they've said proves their initial assumptions. You said that you did not believe that you were a good mother. So is there anything you said that proves that, or is there anything you said that disproves that? Look for evidence. You're going to ask questions that help them prove a point, such as, looking for causes, looking for evidence to prove what they're assuming or to deny what they're assuming. Perspective, you want to make this person step back and look at their situation from a completely different point of view. Discovering consequences, that's when you are asked how something ties into a different topic or what the ramifications of what they've been doing, are. Help them to think deeply about the issue. And questioning the question is further attempting to add depth. You may ask what the other person thinks the point of your questions are, what the situation at large really means. So you really are trying to get a deep look, a deep dive into this person, their assumptions, what they're thinking, and what brought them there. Some basic assumptions of therapy are, one, clients are doing the best they can at any given time or moment. People are more used to not being validated, to being failing, to being judged. So you're providing support and validation of their efforts. Clients want to improve. They wouldn't be there if they didn't. Even clients who are difficult, they're stalling, they're not doing what they need to do. They want something different. On the flip side of that, clients need to try harder and be more motivated. And this is just saying that they have to participate in their own recovery or their own move forward. Getting better is hard work, and but it's worth the effort. If the client isn't moving forward, then the therapist steps back and tries to analyze with the client what is interfering, what's blocking them. And these basic assumptions are actually discussed with the patient up front. This is what this therapy, this is what we believe. Another one, and this was kind of hard, clients may not have caused all their problems, but they have to solve them anyway. This is especially true when a client who's experienced trauma. The client responded to their trauma with what maybe at first were adaptive behaviors. However, these same behaviors may be holding them back and causing problems over time. So, and then, blaming the past makes the client a victim again. And this is getting them to the point where they have the power to change. Realizing that the lives of their clients are unbearable as they are currently being lived. So you want to validate their distress and accept the misery they have, while recognizing that the only solution is change. The client must learn new behaviors in all relevant contexts. In other words, while these new skills and behaviors are practiced, the client must also be able to apply them in different situations, even distressing ones. This is a tough one. Clients cannot fail. Basically, don't give up. If client is stalled in therapy, the therapist needs to enhance their engagement and commitment, reevaluate the plan. Not that there aren't instances where the client refuses to participate and that's it. But if the client is there in their sessions, keep going. And the last one, this is really important. Therapist treating the difficult client needs support. So they have consultation groups that serve to treat the therapist by using the same skills that they are using with the clients. In these weekly groups, the therapists engage in discussing the effects of what they are doing and also in advocating for self-care for each other. So that's a big basic principle of this type of therapy, that therapists also need support. Principles, again, treatment takes time. It says most believe it takes at least a year is required for this type of treatment to be effective. That the client must attend these individual and group sessions. If they aren't, then there is a point where the client would need to just be discharged. But as long as they're in them, you keep going ahead. Suicidal and self-harming behaviors are problems to be solved, and they have the highest priority. And otherwise, these must be addressed first. And also, you do have to establish some boundaries. The therapist, with the amount of time, with the availability of phone consultation, in addition to the other sessions, is very engaged with these patients, but boundaries must be in place so that the therapists themselves can remain healthy. Part of these group sessions are really skills training. And I put down some of them here just to kind of give you an idea. But these are some of the basic skill modules they really focus on. And they may spend like 6 weeks on the core mindfulness. They move to another one. As you can see here, you begin with mindfulness techniques, and there's a lot of different exercises involved. How to tolerate distress, more exercises. How to regulate your emotions. And there's all of these are different exercises that you do, things that you practice so that you can then apply them in your life. You maintain a diary card that talks about when you practice these, when you apply them, and they share this as they come to their group meeting. They work on interpersonal skills, how to listen, what is passive versus aggressive, and how to self-manage, how to set goals, how to look at your own behaviors. What are your contingency plans for this very stressful situation that you sometimes find yourself in? So these are just some of the skills training that are done. Again, they teach them in class, they practice them in class, they practice them at home, they apply them, they come back and share. So it's very intense. This is just an example of one of the exercises I wanted to show you. This is called the wise mind. And the wise mind, they have their emotional mind and all the things that goes with their feelings, urges, how this made them feel, you know. And then they have the rational mind where they're looking at the facts. Here's the facts. Here's the logic behind this. This is why I have done this in the past or why I haven't done this. And you kind of pull these together. Uh, I feel this. I do feel this, but I know this. So how am I going to handle this? So you're trying to not be ruled by your emotions, but not disregard them because they are there, but also look at what's the facts and put it together with a rational, uh, normal response. So that's just one of the activities they do. All right. Well, thank you guys very much. And that is all for that.